Massachusetts is the only state requiring its hospitals to establish patient and family advisory councils, otherwise known as PFACs. These groups of patient and family advisors work with the hospital on improving care and the care experience. As part of our work, Healthcare for All provides training and technical assistance to all of our state's PFACs as we seek to make hospital policies and procedures more patient-centered. In spring 2016, we welcomed more than 300 patient and family advisors as well as hospital leaders to our 4th annual conference, Strengthening Patient and Family Engagement in Massachusetts Hospitals. This video highlights some of the day's activities.
Incorporate patient experience within your host institutions in ways that are meaningful. So this is also a challenge that we see nationwide. In a 2013 to 2014 nationwide survey that paid attention to 1,400 hospitals nationwide, it found that only 40% of those hospitals had PFACs. And of those 40%, only 20% had actually convened and met in the last year.
The topic in general this time around engagement is just tremendous. And again, how do people improve the engagement in their own PFAC, learning from each other what works and what doesn't work. And then the research topic this year is great because we all know that patients in research and other stakeholders in research is a hot topic right now. And I think there's lots and lots of patients who have no idea what research goes on in their institutes, how to get into it.
A little over 5 years ago, I had my surgery for maxillary sinus cancer, and I knew that I could never pay back all the family support, medical service providers, and anyone that helped me. And I would go down to the nurse's station and ask, is there anyone that had something like me that would like to talk to me? And maybe I can give them some experience or insights what they're going to go through. And after doing that a couple of times, the nurse manager says, well, we actually have a PFAC that you should volunteer for.
Last year, 2015, how many hospitals submitted PFAC reports? Anyone want to shout out a guess? 47. 80. 83. 95. It's 67. So mark your bingo card, 67.
So you have PFAC members come together to share what they're doing. People who are a little bit behind can learn what's possible. The people who are doing wonderful things can share all their successes. And so that's really taken place every year. And then also the sessions are informed by what comes into the annual reports.
There is no hard and fast obligation that hospitals report or tell the Attorney General what they're doing for community benefit. There's no sanctions in place.
Just 4 years ago, the first one of these conferences, we had about 2 patients.
In real life, there's people running the hospital day to day, and there's the board that comes for their monthly meetings. And the question is, how much do we want the board to have a conduit for information, but also a way to do something, because they run the hospital, they own the hospital.
We want to make sure that private providers are not also incentivized to take care of people at the level that they need that care. So while we think it's great that there's more care to outpatient, if you don't get the inpatient care, we also think that people who do need it should get it.